namhlanje izihambeli zethu sino Dr. Malifahlo okuwudokotela osebenza ngakho ukusika amabele. Kanti sibe nesihambeli sethu esinye esagulwa yiwo umdlavuza welibele ozosichazela kabanzi ukuthi ibenjani indlela ayihambile. Kanti futhi sibe nodokotela wethu oyi-oncologist uDr. Mlaba kanti neprosthesis uMr. Hamilton Mhlala. Siqhubeke ke nodaba lethu Sisara. Ungathi ubani kumlaleli namhlanje osekhaya uSisara Mudobi?
Ngiyabonga Dr. Prue. Asanibonani balaleli. Sara Mudobi, mama, unkosikazi. And then I'm 49 years old. Ukuqala kwami ukuthi ngithola ukuthi ngine cancer. Ngibe lentozana ngibe ne lamp ngathi tennis ball, but ngekho buhlungu. And then I diagnosed myself. Angiyanga ku doctor. No one told me, but mina ngazitholela ngabona ukuthi no, ibele lami ngathi kunento nje engayi understand. Then ngathi uma sengibona mammogram, I knew about breast cancer, mammogram, because the last time I did a mammogram it was 2013. And then I realized it was 2018 December. Then ngaqala ukuhara manje ukuthi hayi no, ngimele ngiye ku diagnose ngizwe ukuthi kanti lento le elayini. Then ngithe uma ngindlula lapha Eastgate kune mammogram center. Then I just went in, and then ngafika mangifika lapha ngabatshela ukuthi no, I came to do a mammogram. Bangibuza ukuthi why ususpecta anything, ngathi no. The reason I said that it's because most of the time uma uya kudokotela ufika uthi ngizwa la kubhlungu uzwa in. Sometimes they just think ukuthi that's how I told myself ukuthi no, if ngibanikeza clue maybe bazongitshela ukuthi lento le mina ngisuspectayo yiyo. Then I said no, I don't suspect anything. It's just that I haven't done a mammogram since 2013, and now it's 2019. So I went to a mammogram center March, around March. And then mangifika le, then bang faga emshinini, then bangitshela ukuthi no, you do have something, say suspect ukuthi there's something, so you have to do a biopsy. You have to come again next week uzoyenza a biopsy. Then after that, after a biopsy, ama results wafika, and it was in April. And then bangfonela bangitshela ukuthi no, because bangibuze uma ngifika ukuthi udoctor ngathi udoctor wami udoctor eBalfour, but okay sizothumela ama results khona le. Then I went there, and then she told me ukuthi yeah, you've got a cancer, and then breast cancer. And then she referred me to a Mel Park, where I got the doctor that she's still treating me, but now I'm treated by an oncologist, because when you go there, then they do all this diagnosis wabo. So uma ngifika uma sengiqala uqala I treatment yakhona ngiqale ngechemo, bangifake ku chemo, and then around May, and then uma sebangifaka ku chemo, then wathola ukuthi itoxil le bebangifaka yona ayihambelani nomzimba wami, because bathi it differs from person to person. So ngakuphatha kahle, omunye ngamphatha kahle, omunye ngamphathi kahle. Then uma and then bayenza ama test, uma bekufaka ku chemo, then bakwenza ama test ngaphakathi kwendawo. Then uma sengiyenza ama test bathola ukuthi le lamp instead of ishrinkanga, Then it was growing. And then we went back to a drawing board. Ukuthi, okay, uma sekunjalo, sekwenziwani. But sikufaka ku Red Devil, one of the chemotherapies. No, bengibona nje abantu the way bebangakhona, the way beba miserable, the way beba ngathi bayafa. Ay ngathi no. Sat ngathi ku doctor ngathi mina ne family yami sathi okay, usinikeza ama options, but thina asazi wena uwe owazi ukuthi kahle kahle kwenzakalani. So when you are an expert, when you must just tell us ukuthi from la njengoba le ichemo ingasebenzanga siyenza ini. Athi okay, the best thing that we can do ukuthi isejar. So we went for isejar. And enye into engishilo ukuthi uma bekhipha la be say iyangapha njengoba bosho ukuthi ama lymph nodes ngapha. Yeah, they took about 6 bawakhipha la phansi kwekhwapha. So yeah, so I'm a survivor. What I can say ukuthi abantu bangasabi. Ungathi uma ubona ukuthi kunento ongayi-understand ngomzimba wakho bese uyahlala uthi hey ay ngizobona, umele uye uyohlolwa babone ukuthi ngempela yini onayo, and then bazokhona ukukusiza. Ngoba nami if bengihlezi ngithi no ngiyahlala akusinto eserious, but ngizwa nje ukuthi mara the only thing njengoba bethi akuna pain.
Sibonge kakhulu Sisara. Kanti njengoba usuchazile kakhulu ngendima uyihambile, indlela uyihambile yama oncologist nama chemotherapy. Dr. Mlaba, akusithathe ke wena usibekele kahle ukuthi uma umuntu esethi uqala ichemotherapy nenzani kahle hle, kanti nale radiation kwenziwani, ngoba uzwa abantu bekhuluma ngelimi lasestradeni bathi ngiyoshiselwa. Sicela usibekele njengodokotela ukuthi kusuke sekwenziwani kahle hle.
Ngiyabonga Dr. Prue. Ngiyabonga Sisara ukuthi usherishe ijourney yakho nathi. That was very brave, and I do hope that sizoqhubeka ube control the cancer yakho. So you spoke of chemotherapy, which I think is very important for abalaleli ekhaya ukuthi ba understand ukuthi chemotherapy is very important ukucontrola icancer egazini, and ama options akhona siye siwathathe based on ukuthi i-type ye cancer ebonakalile kwi-pathology injani. And kubalekile mawukuthi for instance kune HER2 sisebenzisa ichemo ezotargeta le part le expresswa yona le cancer eyisebenzise ukuthi ikhule. In addition to that, siyamtshela abantu abafana ama patients ethu njengosisara ukuthi i-toxic ichemo inama side effects just like any medication esiye sikunike yona, so that ube aware uzoba prepared. But also we guide you, we look after you during the process of treatment so that we can manage the toxicity. So importantly, you mentioned a Red Devil, for instance. Lo oithi igulise abantu. Iye qede inwele yenze lento sithi alopecia Red Devil. And it can also affect the ability yomzimba, the bone marrow, ukuthi ingasebenzi kahle iproducer ama cells abalekile anjengama red blood cells nama white cells protector from infection ube neutropenia. So kufuneka sikunike something ezokunceda ukuthi wa boost futhi. More importantly, maku ukuthi umuntu omdala onezinto ezifana no high blood pressure, it can affect your heart, Red Devil. So that's why siyenza sure ukuthi inhliziyo yakho ifunctiona kahle, ngoba maku ukuthi usuvele usunenhliziyo engasebenzi kahle ke kufuneka ke sisebenze enye idrug siyeke yona ngoba we're going to make it quite worse, push you into what we call a cardiac failure. The same thing will happen with the other drugs as well. They can affect ukhulumile for instance ukuthi Taxol ayizange ikuphathe kahle nayo, particularly lana kuma nerves, the small nerves zezandla naseinyaweni, what we call a peripheral neuropathy. And most of these things will reverse masisiqedile chemotherapy. But wazi ukuthi i-medical oncologist yakho or your clinical oncologist will look after you during that time. And then asizeke radiation therapy that you also had. Radiation therapy is just to control locally la i-cancer iqale khona or na la i-spread khona locally or local regionally, where Dr. Malifahlo would have gone, wakipa leo party ebele, wakipa nama lymph nodes. Then I go in to further consolidate senza show ukuthi i-cancer ayibuyi la, what we call recurrence, ayizubuya la kadiqele khona. So these are deep energy x-rays esiwasebenzisayo ungena emshinini, then bese siyak-treata for 3 weeks or up to 5 weeks every day, Monday to Friday, ukontrola i-cancer ukuthi ingabuyi la iqale khona or ingaspread umzimba wonke. Nayo
lapho Dr. Mlaba ngenxa yesikhathi sibe sesingena kuwe Dr. Malifahlo, uma senimthatha nimisa e-theater nisika ini kusuke kwenzakalani lapho, ungakusichazela nje masinyane nje ngoba isikhathi sesidliwe yinja.
Usisara ukhulume into ebaluleke kakhulu ukuthi bayikhiphile i-cancer kodwa amabele asisekhona. In 2021 there's new ways of doing things. Awumelanga uluze ibele lakho lonke uhlala ungena ibele if kungekho isidingo. Yes, that's why sine into sibiza i-oncoplastic surgery. I-oncoplastic surgery sikhipha i-cancer siphinde silungise amabele ahlale kahle. Singawalungisa siwa-reduce isize, sithathe ngapha sifile ngapha, or sibizo umuntu ofana no Mr. Hamilton eze nama-prosthesis siwafake bese uhlala the way beungakhona or even better sometimes, and then cancer free at the same time.
Usakhuluma ngo Mr. Hamilton i-prosthesis, siyazi ukuthi psychologically abomama baba affected kanti futhi into ebenza ibasaba ukuya kubodokotela ngenxa bazokukhathiwa libele kube khona lokho usakhuluma ngakho dokotela. Ungathini Mr. Hamilton ngalomsebenzi owenzayo ukusichazela nje usibekele isithombe ukuthi nisebenza kanjani, especially psychologically kubaluleke ngani ukuthi umuntu uma sekaqedile ukuya ku-surgery ahambele kunini?
Thabela ko leboga ngaka nna ke nna Mohlala Hamilton ka lebitso ke ko private ko eMalahleni, so ke bereka Hamilton Orthopedic Services. In terms of psychological, bo mama ba ba le low self esteem ratsa re bo mme ke batho ba le hore ba rato apara hantle then ba be seemong se se right, but ka baka la gore dingaka di shetse di ntšhitše letswele, that's why ba loser ntho e re bitsa self esteem a sa ba gona ga a sa tikutlwa nkare ke mme. So le ko dikobong le gona wa iputša gore molekane wa gagwe o mmona a le jwang ka gobane o latlhegetše ke setho se sengwe se a se šomišang bjale ka mme ko gae. So ke tsona dilo tše le gore di affecta balwetši ba rena ga kudu. So when it comes to breast prosthesis ke ntho e thušang gore e kgone booster self esteem ya mme ga fetšo o ripiwa letswele ka gobane dingaka di ntšha letswele ka moka go tša re mme a sana letswele at all. Some of the patient go tša ba fakile di towel or something like the toilet paper just to boost their esteem ke problem e re lebaneng le yona ngaka. Amen.
So lena is-prosthesis lirang bjanong ke eng mmereko wa lena mo?
Okay, ga re lebelela kudu ka mmereko wa rena ko re kgone go thuša di-patient tše le gore šetse di amputatile matswele a bona a setlang a sana letswele. What do? We have to measure the patient so that you can get the right bra size. We call it a mastectomy bra, and then re hwetše le breast prosthesis e le gore e tlo fitha gabotse. So how do we do when we measure the bra tša bomme ba le gore ba latlhegetše ke matswele? So what do? Just measure underneath ka fase ga letswele la gago, right round, and you add 4. That one you'll get the bra chart. Kore e tla go bontšha gore mme o apara 32E or 32D. So that's how we get the sizing. And one thing ga re dirang gore re hwetše sizing ya letswele gore matswele a kgone go bontšha gore a lekana or a dira eng. What we just measure above the breast, the remaining breast. I can tell some of the time, but repeat letswele la ka mo left, then measure on top of letswele la ka mo right. So measure mo di malona up until the center of the spine, then times I got 2. That's where we get the cup size of the breast.
Sesivala nje Dr. Mlaba, ungathini kumbukeli lapha ekhaya?
Ngiyabonga Dr. Prue. Balaleli ekhaya, babukeli ekhaya, kubalulekile ukuthi sihambele phezulu njengoba eshesilo sisara mawubona ama signs and symptoms are suspicious akutshela ukuthi ngenzeka kube yicancer ngoba ama survival rates ethu ayabonisa ukuthi if uyithole early icancer in 5 years almost 100% of all the cancer patients are still surviving. But if seku late isispreadile, we are now talking about 1/3 of the patients. So 1 in 3 of those patients only would be alive. So engakusho mina is that ngiyanicela nigijime niye clinic uye ku GP mawubona ama signs akutshela ukuthi ngenzeka ukuthi une cancer.
Mr Mlaba, kuwe nje lapho osekhaya ungathini kuyena okhalayo namhlanje ukuthi odokotela balisusile ibele kuyena?
Ke a leboga ngaka. Balwetse ka moka ko magaeng ba lebeledi ka moka ko magaeng ke kgopela gore ge re ska tšhaba go botšiša ka mahala ge letswa le setse le ntšhitšwe there are so many ways le gore ka survive le wena o ska tšhaba wa dula gae wa re o ka se kry thušo di gona di tletse ko ntle tsamaya ko ditleliniki tša bolena ba tla lefa information e tletseng. Ke a leboga ngaka.
Dr Malefahlo, o ka botsa dingaka tsa rena tse nyakang ho ba di breast surgeon wa reng ko bona hore ke tse feng tse tshwantse ba dire hore ba tshwane le wena?
Dr. Prue le babogedi ko gae, South Africa ka bophara e hloka di breast surgeons. We're very much in need. There's a shortage of surgeons in general. So how anybody are keen to become a surgeon like me, going into medicine is the only route to get to become a breast surgeon. So you have to study, sometimes it's 5 years or 6 years, depending on the university. How fetcha your internship, the community service, your masters or your fellowship with the College of Medicines of South Africa, then your masters in surgery. It's a very long road. And a lot of people get discouraged by the road. Don't be discouraged. South Africa is the specialists, the skills, the specialists, especially in the public sectors as well.
Thank you ngaka. Awusar, akutshela ababukeli bethu emakhaya ukuthi labo abasasabayo uma babone impawu bafanele benze njani?
Ngiyabonga Dr. Prue. Eka babukeli uma ungazizwa kahle iya uyohlolwa. And labo abanesifo
Dlavuza welibele?
webele ningasabi. Abantu abaningi bacabanga ukuthi uma you are diagnosed with cancer so uyafa. Ayikho leyo. I'm a living testimony. Bana nethemba. If umuntu okhulekayo khuleka and then themba, but there is life after the treatment of cancer. Thank you.
Ngibonge kakhulu kini nonke zihambeli sami. Ngibonge nawe lapho mbukeli ekhaya. Siphinde sitholane ngokuzayo kuzo ezempilo zamudakalo with Dr. Prue.